Good morning, everyone, and welcome to today's session on nutrition and pregnancy. To talk on this topic, we have Dr. Seema Sharma. She's an in-house obstetrician and gynecologist associated with Moti Nagar Center in Delhi. To give a brief background about our doctor, she has done her MBBS, DGU, and MD. She has done her FMAS, MRCOG, FICOG, and FRCOG from UK University. She's a very well-known doctor associated with us, and she's going to talk about a very important topic of nutrition in pregnancy. So, what to be eaten, what not to be eaten, what are the different myths that that needs to be handled. So, we have Dr. Seema Sharma here. Doctor, welcome to today's session, and we are looking forward to hear from you. Thank you. Now it's all yours.
Thank you so much for such a lovely introduction. And I would be talking about nutrition in pregnancy because a lot of patients have huge amount of queries and they can't, really discuss each and every aspect of nutrition with their gynecologist because of lack of time in the OPDs. And also when you go home, so many more queries come to your mind as to uh, what you should be eating. Your mom-in-law says this, your neighbor says that, and books say something else, and internet says something else. So there is a huge amount of queries, and I would love if patients can ask me questions so that I can sort the ones that is troubling you. But by and large, I would give you a free background about nutrition. Look, a lot of patients keep asking me whether they should follow a diet plan, or there is a specific diet in pregnancy. Well, no, there is no one size which fits all. You need to go with your own body. You need to go with your own nutrition. If you are anemic, you need to eat a certain kind of food. If you're obese, you need to keep your weight in check. You need to eat lesser number of calories. So sometimes the diet plans have to be modified for yourself, that the dietitian does. By and large, we normally say you should always go with your own body signals. If you feel hungry, you must eat small portions. Eat them more frequently, though. In pregnancy, you don't need to increase your calories. You don't need to eat for two people. You should just eat for your own self. And say if you're in the first trimester, you need just 100 calories extra. In the last trimester, you need probably 300 calories extra. And the maximum number of calories that you need is when you're breastfeeding your baby. Do not overeat is my strict instruction, because a lot of people in West Delhi at least are over the normal BMI, and obesity causes a lot of problems. If you just increase maybe a katori of dal or maybe an egg extra, your calorie requirements are complete. And you try and not overstuff yourself. Always listen to your own advice. It's not that your mom-in-law says beta doodh pio, and then you just don't, the smell is causing you nausea and you still have that milk, and then you vomit it out. You should not do that. Always listen to your own self. And also try and include all colors in your diet, like fruits and vegetables. If you look at your plate of food, it should be a vibrant plate of food. Your plate should have a red, a green, a yellow. It should not be like a white rice or white curd, or white of everything, white dal. So have a green color cucumber, or a spinach, or a methi, or a kira, or a red color as in pomegranate, as in red vegetables, tomatoes, and all that, as in fruits and vegetables. And keep your food simple. Do not have too much processed food, because they have a lot of hidden sugars, they have a lot of hidden salt, which is not so good for you, and they also cause sugar crash. So when you're eating sugary food, or a lot of carbohydrates in your meal, you will have a hunger pan coming faster. And the problem is not the meal that you have had. The problem is, when the sugar crash comes, you suddenly get very restless to eat something. And that's the time you grab nonsensical things like chips or Maggie or other stuff, which are not going to be good for your system, but you still grab it because the sugar crash has come. So try and have more complex carbohydrates, have enough amount of proteins and good fats in your diet, and include all colors. And you would not go wrong in your diet selection. If beyond there is something, that there is certain kind of food that you feel you can always ask your doctor, you can ask me here. But by and large, you stick to everything, whatever the nature gives you. Do not overcook your food, and also try and include all colors. You would be bang on, and you would not gain too much weight, and you will have all nutrition in your diet. Well, that was the basic about diet. And also, please make sure that you do not put on too much weight in your pregnancy. A lot of people keep asking, or kya khau, and already I see their body weight is 100 kg plus. So, well, if your BMI is more than 30, your weight gain should be restricted to 8, maximum 10 kilos from the beginning to the delivery point. Do not gain too much weight, say around 12, 13, 15, 18 kgs, 20 kgs people gain. There is no need to eat so much in your pregnancy. So colors are very important, and avoid overcooking. That is another point you must look at. Wash your food properly. All fruits should be washed in 30 seconds running water before you consume them. And my advice is, you must peel your fruits before you have them, because all all the peels, they have a lot of pesticides. So that's why things like banana and all are pretty good to have, because the thick peel is very thick. The lesser chances of contamination by pesticides, surface pesticides at least. And all those fruits which have very thin peel, like say grapes, like say strawberries, you can't wash them away, and the pesticide has actually seeped inside. So those kind of fruits should be limited in pregnancy. Even if they're good nutrition, pesticide is very dangerous to have too much in too much quantity. So restrict your intake of, say, grapes, say strawberries, all those fruits which have very thin peel. And also, while I am talking about fruits, try and avoid very raw fruits, especially in the first trimester. So we always say, like raw papaya, which we use to make raw papaya salad, raw pineapple, raw banana, all those things should be consumed less or not at all in the first trimester, because they have certain toxin which can be dangerous. And if you take it in too much quantity, it can cause abortions as well. But that's an over exaggeration. Those kind of things happen when somebody develops a fetish कि भाई अब तो मुझे यही खाना है और मुझे कुछ और नहीं खाना, और सुबह शाम रात आप सिर्फ पपीता खाना चाह रहे हो, और रॉ पपाया सैलेड आपको पसंद आ रहा है, आप वही खाना चाह रहे हो. Unless in normal quantities, don't bother so much, but try and minimize your consumption of these fruits. So I think I will now leave the floor open. I think we would love it if people can ask questions, so that I can keep answering them. So do we have any questions already? Okay, so if we don't have questions, I will talk about things which my patients mostly inquire about. One is, should you be having a papaya in your meal? Is papaya to be avoided or not? Well, when we say should papaya be eaten or not, ripe papaya is very good. I don't know if people have actually even seen the raw papaya. It's like a greenish fruit, and if you peel it, it gives you that white milky secretion. So all that papayas which are ripe, uh, the reddish color or the orangish color papaya, they are very good. They avoid it gives you a lot of lycopene, it gives you a lot of fiber to keep your constipation away. So there is no problem in having that kind of papaya. So you need not avoid papaya, because I see a lot of women avoid papaya totally in their pregnancies. Like if say even one piece they have eaten, they would die of guilt. So no, ripe papaya is a good fruit to have. Please include that in your meals. It's only the raw green papaya that we say you should not have. And when you cut that papaya, if it gives you that white milky secretions, that secretion is not fantastic for your baby. So that should be avoided. Rest, please go ahead. So we have questions coming in now. I would take the first question. Um, how many glasses of water should we drink during pregnancies? Fantastic question, Aarti, because water is something, people just keep saying have a lot of water, but nobody really knows how much water to be have. And I also sometimes, ask people, and women tell me, I take 3 to 4, even 5 liters of water. And I was like, oh my God, are you a fish? They were that way. You will keep on sitting in the washroom all the day, because so much water is not needed by the body. Water intake depends on a lot of factors. If depends on what atmosphere you are in. If you're in a cold atmosphere, your water intake requirements are lower. If you're in a heated environment, you are already sweating. Or if you have a nose block, you're breathing through your mouth, your water intake should be higher as compared to somebody who doesn't have these things. Water intake should be guided by your urine color. If your urine is whitish or just a pale yellow straw colored urine, you are doing fine. On the other hand, if your urine is very yellow, orangey, if it is smelling bad, you need to increase your water intake. How much will depend on what you see before you flush your pee, and gradually you would know how much water you need to drink. Some people, are okay with even taking 4 glasses of water in a day. For others, who are doing manual work, sweating a lot, you may need 4 liters. But then somebody who's sitting in AC, just generally, there is, like I keep saying, there is no one size which fits all. You need to go with what your body is, what the kind of work you are doing, how much your body is used to taking, and what is your urine output. If your urine is clear, you're doing fine. You don't have to really go on and on, right? Next question is, how many glasses of milk is necessary during pregnancy? Again, a fantastic question, very commonly asked question. Milk is essentially, very deep into our psyche, and we feel you need to drink a lot of milk to become healthy. Milk is in various forms. You can have cow's milk, you can have soya milk, you can have oat milk, you can have almond milk, so many types of milk. Now, why do we want to take milk? We consider milk as a very good source of calcium and certain other vitamins. But also, green vegetables are very good sources of calciums. Also, as gynecologists, we try and supplement you in pregnancy as well for calciums. So if you can take a glass of milk morning and evening, you are doing fine. But if on the other hand, milk doesn't suit you, when you have milk, you have a lot of bloating, you have belching, you fart, and it's not suiting you, you could be lactose intolerant. And that way you could shift. If you still want to have milk, you could shift to soya milk or oat milks, and those kind of milks are also very nutritious. So depends on what is the kind of system that you have developed. One in 3 Indians are lactose intolerant, and we don't even know, and we continue to have milk after milk. And there are a lot of patients who would come back and they tell me कि मेरे से तो उल्टी आ रही है दूध पीने से, मम्मी फिर भी बोल रही है कि दूध पीना जरूरी है. So you have to really go with your own system. If your system is telling you something, please stop and listen. Because if you're lactose intolerant, you're going to have more harm by taking milk than benefit. But on the other hand, if you like milk, you're tolerating it well, uh, morning and evening, one glass of milk is more than enough. And one glass of milk is 150 milliliters of milk, not like more than that. So you should try and have a balanced diet, and not you know take all nutrition from one kind of meal. Earlier, in India, we were always a dairy rich and dairy predominant society. So we had cows in every house, and everything was coming from that cow. So you had milk, you had paneer, you had dahi, you had. So still, Indian households rely very heavily on milk. But there was a recent survey done in Delhi which said that 99.9% of milk available in Delhi has higher amount of pesticides, higher amount of antibiotics than a pregnant patient should consume. So it was much higher than the permissible limit approved by the WHO. So clearly, too much of this kind of milk, which has hormones, and the cows are being injected to, with antibiotics, with other stuff to give more amount of milk. This kind of milk is, I don't think it's going to be really useful. Again, there's a controversy whether you should have an A1 milk or an A2 milk. So, well, I leave that for some other day. but then essentially go with your own system. If you like something, have it. If you're digesting it, have it morning and evening. If you cannot, just drop it, right? So the next question I would take is any tips to avoid groin infection due to sweat during summer? Not by This is not our topic for today, but groin infections, fungal infections are very common in pregnancy. If you can maintain your blood sugar in the normal range, you will have lesser groin infections. A normal person should not have groin infection, whether pregnant or not. Well, if you're in a very heated environment, very sweaty environment, you are active gymmer, I would recommend putting a talcum powder on top of your underwear, not on the skin side, but the outside. So what this talcum is, any talcum, it's not, should not be a fungal talcum or perfume talcum, any simple talcum, spread it on the outside of your underwear. So what it will do is, by capillary action, it will absorb the sweat drops and your groin area would be dry. Also avoid the tendency for washing again and again. So sometimes, if people go, women, want to go pee, and then they wash themselves nicely with water, with jet spray, and then they forget to dry themselves and they just pull up their underpants. So the reason, then, the underpants are, they have absorbed the water which was on the skin, and as a result your skin is perpetually in a moisture zone, because now your underwear is wet and it is going to have that wetness around, so it is going to attract fungus sooner or later. So you don't have to wash yourself so many times. If you still feel dirty, you want to keep yourself, like, you feel, oh, this is not part of my hygiene, I want to wash it. So then wash it, but please dry it nicely with tissues and then pull up your underpants. Or use a panty liner, which you should remove every 4 hourly, so that there is no added moisture in that area. But simply using a talcum powder and not wetting your area again and again would keep you away from groin infection. The next question, my parents ask me to eat leafy vegetables every alternate day. Is it okay? Should I? No, no, leafy vegetables you should include in all meals. They're a fantastic source of everything. And I always say, use colors in your diet. Why would you not have green leafy vegetables? It's very, very good. In fact, these are green leafy vegetables should be minimally cooked. And, if you just consume one portion at least every day, as in salads, as in minimally cooked food, as in methi, palak, whatever, I think that's fantastic. You must do that. In fact, I would say, no, you should not reduce the frequency. You should increase the frequency. Have it every day if you can digest it. So another question is, can we use Shatavari in milk? So I assume that whosoever has asked this question is lactating, because Shatavari is not otherwise required in when you're pregnant. So, well, if you're trying to looking at increasing your breast milk output, Shatavari is fantastic. In fact, all the commercially available powders like tonic, like Galec, like Lactaires, and all those, they do have some portion of Shatavari. So I think they have made your life easier. If you want to just buy Shatavari powder and mix it in milk, go ahead. But that is only useful when you're breastfeeding, not otherwise, not in when you're pregnant. So I think I would just move on and kind of if we have time, so can we take more topics? I can't hear you, so we have time. Okay. So I wanted to also tell you about a few things like nuts, which people ask me a lot in my practice. Somehow, we feel that nuts are important part of our diet, and everybody asks me how much we should consume, how should we consume. So I'll clarify about nuts here. Nuts are like, there are thousands of varieties of nuts, but in India, majority we talk about almonds, walnuts, kishmish. Raisins are also of many varieties, but Indians usually stick to munakkas when it comes to pregnant patients, and cashew nuts. Then, I would recommend, if you want to have nuts in your diet, don't overdo one, because they're hard to digest. They can cause a lot of flatulence, and also they're dirty, because they have been handled by food handlers, coming from wholesalers into the plastic bags to or the Kiryana stores, and everybody handles them not in a very hygienic way. So one is you must limit your intake. So for a pregnant patient, I would say 5 almonds, 2 figs, 5 munakkas, and 2 walnut kernels are one snack. And also when you are having them, you can have them in the morning, you can have them anytime. They are very good sources of omega 3. They are very good sources of fiber as well, so they can keep your constipation away, make you full also. They're healthy sources of food when it comes to a snack. So this much portion is a snack for a pregnant patient, but please ensure that you're soaking them overnight. By soaking them, you are activating the enzymes that are required to digest it. So you will be able to utilize the proteins which are there in the nuts. Also, if possible, peel them, because though of course with peeling you will lose little bit of fiber, but I would again say that the peel on top of say walnut or almond, it restricts the absorption of certain important proteins in your system. So if you remove it, it becomes easily available to your body. A lot of hard work, but yes, definitely soaking should be definitely done, because it removes all the surface impurities. Also, the nuts will absorb water, they will become bigger in size, and they will have higher enzymes which will help them to give you the goodness of nuts that they're supposed to have. Again, another question a lot of people ask me, are chia seeds okay to have? Again, a fancy question. Chia seeds are, you know, earlier, at my age, I remember chia seeds used to be available at every single pansari, and nobody used to ever have them. But never since West has started having chia seeds, it's certainly become a fancy seed to have. So chia seeds are good to have. There's no problem in having them, but you should restrict, like anything else, like any food, restrict your intake of chia seeds. I think 1 tablespoon is more than enough in a day. You can sprinkle them on your salads, you can use them in your shakes, you can use them, eat them the way you want. But you must soak them, like for nuts you must soak them for at least 30 minutes prior to consumption, because when they will absorb water, their omega 3s will also become in more absorbable form. And chia seeds are very high in fiber, so it's very, very good for women who have a diabetic issue. Their blood sugars are going haywire. Chia seeds would help them to stabilize the blood sugars. So by all means, please have your chia seeds. There is no problem. Also, some people also ask me, what about omega 3? How should we have? Should we have omega 3 supplements? Should we not have? Omega 3 is essentially, a sort of fatty acids, and there are two types, though there are many, but there are two types that we talk about. Like, one is an EPA, one is a DHA. So these are the two types of omega 3s which are available in the market, and they are also available in capsules form in the market. Now, when you are taking capsules, there is a tendency that they may cause belching, they may cause flatulence. Also, the absorption in capsules is very erratic. We don't know whatever is mentioned, the body is actually getting that much EPA, that much DHA or not. I personally do not recommend it routinely, especially if you're a non-veg eater, if you have a lot of, variety in your meals. If you have fish, you are okay, 2 to 3 times in a week. If you are having fish, and fish is like not more than 100 grams at one go to avoid mercury toxicity. So if you have that much fish, you are likely to complete your omega 3s. Vegetarians usually have a harder time to have their omega 3 RDA completed, because very few vegetarian sources have omega 3s, and the highest omega 3s are available in walnuts. So if you have 2 to 3 walnuts in a day, you're kind of done. But beyond that, if you still want to go ahead and take supplements, there is no problem in the supplements, but they are expensive, and we are not very sure. Various types are available. We are personally not sure how much of the omega 3s the body is absorbing and how much is the benefit. And please remember that too much use of supplementation is not good for the body, irrespective of what your cousins, your chachi tais might tell you, beta ye bhi kha le, wo bhi kha le. But too much of everything is not so good. And high dose of even iron supplementation in people who don't need it, or calcium supplementation or multivitamin supplementation, is now research is coming to the forefront that so much supplementation can actually be harmful to the baby, and it can also change the epigenetics of the growing fetus inside. It can change the genetics of the baby. So take as much as your body needs, take to the point where deficiency is not there, but don't overdo it. Don't just keep popping pills and not pay attention to what you are putting in your mouth, right? So I don't see any more questions here. So all those pregnant patients who are looking at this session, please remember that you are your baby's factory. Whatever good raw material you would provide to your baby, the baby, your end product, will be that much healthier. So I always joke with my patients that till the baby is inside, baby doesn't do choo chapad, and baby keeps silently taking whatever the mom gives. Once the baby is out, this baby will fall sick again and again if the raw material provided by the mother is not good. So, and everybody knows that till the baby is happy and healthy, everybody wants to play with the baby. But the baby is sick, mother has to look after and say, Ja beta, maa ke paas ja. So, if you want a happy life, happy parenthood, please put good things in your mouth. Avoid street food, avoid your chaat papadis and dahi bhallas and golgappas and tikkis and God knows what, salads from outside, cut fruits from outside, your makhani stuff, your tandoori stuff from outside, which is may not be very well cooked from inside. Avoid all that. Avoid all those foods which can give you infection. Or when you feel that people would have put in their hands inside in preparation and the food is not at boiling temperature, avoid eating from outside those kind of foods. So when you go out and eat, choose sensibly, and also try and include all colors in your diet, and well, you wouldn't go wrong. So take your pregnancy enjoy a little bit with uh, more seriousness about diet, because diet is really the basis of everything. And leave your junking for some time later when the baby is out and not dependent on you, and try and have a healthy diet and healthy pregnancy. Well, that's all for today, and we look forward to many more sessions. We look forward to more questions from you next time. That's all for today. Take care. Bye bye.
Thank you, ma'am. Thank you for the wonderful session. It was really nice knowing various, the tactics and tips for nutrition. It was wonderful listening to you. Thank you so much. Have
Thank
a
you
great
so
day.
much. Thank you very much. Lovely. Bye bye.
Bye.